So what better setting than a community to start this discussion. So Kathryn, welcome. And so in your 20 years experience, why is it so patient-centric and not, say, product-centric or treatment-centric?
Well, if I go back to my original training, which was in England, we were taught what I call classical naturopathy. It's not the naturopathy that's taught today. It's a diet foundation where you're actually changing the conditions in a person's body so that they can heal themselves, which means that you're taking them off products, whether they're natural products or medical products. We also had a professor there who was building his own nutritional supplement company, so we learnt the nutritional medicine and how to apply specific minerals within the case. So of course I went off and thought, great, I can start to heal people and get those healing crises and everything that we're taught about moving the toxins to the outside, big healing crisis, patients cured. Wrong. Okay, so I started working with patients, a lot of children which do respond well, and using the supplements, and I wasn't getting what I'd been taught that could happen. So it was like a belief system. So then I decided that I'd go and study the Gerson therapy, because Dr. Gerson had these wonderful results with patients with cancer back in the 1950s. He was a Jew that was exiled from, well, he forced himself into exile just before the Second World War, went to America, well, he did set up practice, but he couldn't take on cancer patients because it was illegal to treat them in any other way than chemotherapy, radiotherapy, etc. So he had the actual people that they'd finished with, where there was no hope. He had a 50% success record with very terminally ill cancer patients. And he brought them through using a specific dietary protocol, very few supplements, and each supplement he used was for a specific purpose, so he knew what he was trying to achieve by putting those things in. And of course they became perfectly healthy and product-free, and he had these amazing healing crises. So I thought, I have to go and learn about this this therapy, and I did, and I went over to America and I did 2 weeks in the hospital over there. It was an internship, and I saw some miraculous things occurring. For example, one lady, after the first week of being on the therapy, we went into her room and her nose was huge, like it was completely swollen like an orange. And we said, oh my goodness, what's happening? She'd had some plastic surgery done and a little bit of tissue put in there, whatever it is they put in, and the body was rejecting it. So the body was pushing out. Once you build the vitality of the cells to a certain point, it will reject what shouldn't be there and it will heal itself. So I was witnessing all these things, and then I came back and started practicing. And eventually, well, probably within 18 months, I kept on at the Gerson Institute emailing them and saying, you know, your training isn't very good, and what about this and what about that? And they got so fed up with me. They said, would you like to become a director of the Institute and write the training manual? So that's what I did. Then I started teaching in America, teaching in England, teaching in Munich. And these were doctors. I had quite a few oncologists, chiropractors. It wasn't just from the alternative field. In Europe, the industry is much more buoyant in terms of integrative medicine, where they're looking at actually what does work, what will improve a patient's outcome. And that comes to the point where my work has always been patient-centric, not therapy-centric. It's what is it that's going to work for that patient to get them to where they want to go. And you know, I watch with horror because I get so many people who are so chronically sick, and I've seen them go through the system, both the conventional system and the alternative system, with nobody taking the case, looking at it, and saying, how can we get this patient the best outcome? So I had one man who had prostate cancer, and he went to a practitioner who decided that they were going to do a bioimpedance test on him. And they said, oh, you know, this is terrible. I can give you a diet to change this test, which is, I don't know, it's a ratio between water and fat. And so she put him on this high-protein diet, and when he went back, of course, the test read perfect. And he said to her, but my PSA has gone up, it's skyrocketed. Because what's tending to happen is people are monitoring the test results and not what's happening to the patient. So over the last 20 years, I've been probably catapulted into a patient advocacy role, where patients come and they say, look, I need to do conventional medicine, but this is my endpoint. Ideally, I want to be drug-free and I want to be cured, and they can't offer me that. So can you help me navigate so that I get the best outcome? And I started to devise simple questions that the patient could ask, and where a consultant wouldn't feel that they were being pushed into the corner and getting stroppy. And then over a period of probably 10 years, I saw that there were generic questions coming out. And then by chance, I was peering over Stephen's shoulder one day, and I saw that he was developing this value framework, which is a framework where you can get multiple parties to collaborate. So from a patient's perspective, if they could be clear about where they were trying to get to, then they could go to their multiple practitioners, present that, and say to them quite simply, can you help me get there, and how? So for me, it's the patient's journey that's more important than the actual practice or the therapy. The fact that I practice a therapy that does work is a bonus in itself. But I do get patients who say, I can't do what you're proposing, it's too hard. So we look at what their criteria is, and we make the journey that patient's journey, which factors in how much they can afford, whether they can travel for treatment, and we build up a program for them to get the best outcome.
Thank you. We're going to come back to a few points there, but I think I'd like to sort of bring this and ground this and compare it to say, well, so what? If you do all of that, does that actually work? And so I've listened over the years to some really interesting examples. I just want to tease one out here, not particularly in the big case study. And some of these, I'll give you some details at the end of it, are online. Some of the case studies I refer where people have written about their own life experience and hold on to it, because some of them are quite moving. Because a health journey is only part of it is actually the treatment. The rest of it is everything else that goes on in our lives. But there's one that was from somebody from Melbourne, which really caught my attention. Had an autoimmune disease. Now, what I asked is, Kathryn, is really so we've got some measurement. What the experience of the person, but what was their clinical measurement as well. And in this instance, this person was defined as terminal, and it wasn't wrong. And there was a journey there which got them to a complete cure in 3 years. So could you just give some example of how any of that aspect was applied to this person?
Well, this lady, she was in her early 30s, and she'd worked as cabin crew for about 13 years, so in the airlines, and she was diagnosed with myasthenia gravis, which is an autoimmune condition where your nerves don't talk to your muscles. So she'd been through the whole system, she'd taken the medical drugs to try and put her into remission. And she'd reached the point where none of the drugs were working and they were giving her additional side effects. Now, in her case, what was happening is her voice box was becoming paralysed. She couldn't close her eyes, so they had to be stuck down at night. She couldn't walk very well. She couldn't lift her arms above so far. And when she phoned me up from Melbourne, she actually had to try and spell everything out because I couldn't understand what she was saying. So I'd never seen this lady. And she said, do you think you can help me? She said, I've got the Gerson therapy, I've got the book. do you think you can help me? Because you're the only person therapist in Australia. So I said, I don't know, because I've never treated anyone with myasthenia gravis, and I don't know, but I said, I'm willing to work with you on this. She was at the point where her breathing was becoming affected, so her doctor had said to her, you could go at any time. So we started on the therapy, and we didn't see any improvement in the first year. And then she seemed to drop off the planet. So we kept her head above water. She felt good about the program. And then 2 years after that, so that's 3 years, I'm down in Melbourne, and I get a phone call, and she said, do you know who this is? And I said, oh my God. I said, you can talk. She said, yes, I'm completely cured. I said, would you like to come along to the workshop? I said, because funnily enough, all the people in this workshop have got autoimmune disease, they're all in pain, they're all on heavy drug medication, and to have someone who's living, breathing the program, who's cured themselves, would be fantastic. And she walked in, and I tell you, we all burst into tears, everybody. And this was the first time I'd seen this lady, and she was beautiful. There was still, if you looked very closely, there was still some sign of paralysis on one side of the face, but other than that, she was perfect. And she said, I'm very shy, so I just asked me questions. So people were saying, well, how long was it before you saw improvement? And she said, oh, not long really. She said it was about 15 months. And of course everybody was just like, how could you keep on doing something for 15 months and not see any improvement? And she just said, well, I wasn't dead. And that was her yardstick, was that she wasn't going and she'd beaten the prognosis that the medical profession had given her. And that's what it's like for most of my patients. They come when they're at the end of the line, and they've tried everything else, and for those people who don't have a choice in that sense, it's this or nothing, they will do the hard yards and stick it. And even in cancer patients, it can be 15 to 18 months before we actually see the tumours shrink. Now, if the tumours aren't growing and they're not pressing on an organ it's going to compromise the function of the body, you can work with that, particularly if the medical profession says, we're not going to do surgery unless you have my chemo or radiotherapy first. So patients will have to, I mean, in some cases I will say to patients, we really need to get that tumour out because the therapy works slowly. We're slowly building the vitality to a point where it can go and attack the tumour, but you haven't got time. So we're working within a framework, and negotiating this very difficult journey when a patient doesn't want to have the chemotherapy, doesn't want the radiotherapy. So I've probably gone off track, but